Hello and welcome to this explainer. Today, we're diving into a really important and, frankly, incredibly sensitive topic, recurrent pregnancy loss. Look, going through a miscarriage is deeply painful, and going through it multiple times, that can just feel completely overwhelming. But if you're watching this right now, I really want to validate your experience. You are taking a powerful step just by seeking out clear, structured information. So in this explainer, we're going to break down the medical guidance straight from the experts at ART Fertility Clinics. We'll look at the science, the facts, and the actionable next steps, keeping everything super straightforward. Let's get right into it.
First off, let's establish exactly what we're talking about here. In the medical world, recurrent pregnancy loss, or RPL for short, is medically defined as having 2 or more miscarriages. If you happen to fall into this category, doctors generally suggest a complete physical examination, especially if you've had 3 repetitive miscarriages. The biggest takeaway here: this is a highly recognized medical condition with dedicated, specific protocols. Seeking answers is absolutely the right move.
Now, here's a statistic that's actually really interesting and honestly, hopefully a bit comforting for you. About 1% of females will experience repeated miscarriages. I know, when you're in the thick of it, it feels like you're literally the only person in the world facing these hurdles. But that 1%, that actually represents a massive community of women worldwide. It's a known biological occurrence. You are absolutely not alone in this journey.
Okay, so here's our roadmap for today. First, understanding recurrent pregnancy loss. Second, uncovering the causes. Third, other medical risk factors. Fourth, testing and assessment. And finally, treatment and next steps.
Section 1. Understanding recurrent pregnancy loss.
It is absolutely vital we clear up a super common point of confusion right out of the gate. A lot of patients ask, wait, is recurrent miscarriage considered infertility? The short answer is no. They are definitely not the same thing. Infertility strictly refers to having difficulty conceiving a child in the first place. Recurrent miscarriage, on the other hand, means that conception is actually happening successfully, but the pregnancies just aren't progressing. This distinction is crucial because it totally changes how your doctor is going to investigate and treat the situation.
Section 2. Uncovering the causes.
Focusing on the biology really helps remove the burden of self-blame. These are medical events, not personal failings. Which brings us to the question nearly every patient asks their doctor. What is the most common reason for recurrent miscarriage? Well, the answer actually lies at the very microscopic level of human reproduction.
The main culprit is right here, aneuploidy. Most miscarriages happen randomly when an abnormal number of chromosomes reaches the embryo during fertilization. Think of chromosomes as our genetic blueprint. If an embryo receives too many or too few of them, it simply can't develop normally, which leads to early pregnancy loss. It's basically just a random biological error during a highly complex cellular process.
And naturally, this leads to questions about age, right? Like, how does age affect this risk? Well, as maternal age increases, the chance of these chromosomal abnormalities, that aneuploidy we just talked about, also rises. Older women produce eggs that are just statistically more likely to have abnormal chromosome numbers. So age is definitely a factor, but really only because it directly influences this underlying genetic math.
There's also another genetic factor we need to talk about called translocation. In some couples dealing with frequent miscarriages, one partner might carry a chromosome where a tiny portion has basically relocated or swapped to another chromosome. The tricky part here, the parent usually shows absolutely 0 signs of this. But when they pass their genetics on during fertilization, the embryo might get a high or low amount of genetic material, and that can trigger a miscarriage.
Aside from the genetics, we also have structural factors. Think of this as the physical environment of the uterus. Sometimes a pregnancy just can't progress simply because the physical space isn't quite right. This could be due to inherited shapes, like a double uterus or a uterine septum, or growths, like large polyps and submucosal fibroids. The really good news about these structural factors, though, is that doctors can usually identify them super clearly during an examination.
Another structural condition to keep on your radar is Asherman syndrome. This is essentially the presence of scar tissue inside the uterine cavity. Just like with polyps or fibroids, this scar tissue can physically hinder an embryo from safely implanting and growing.
Section 3. Other medical risk factors. So beyond genetics and the physical uterus, your overall body chemistry plays a massive role. Let's tackle a very specific and vital question patients ask. Can insulin resistance cause a miscarriage? The answer is a definitive yes. It's really commonly associated with broader endocrine or hormonal disorders. When we talk about endocrine disorders affecting pregnancy, we're primarily looking at unregulated blood sugar levels, like you'd see in diabetes, as well as thyroid dysfunction.
On top of that, women with polycystic ovary syndrome, or PCOS, carry a greater risk of pregnancy loss because of alterations in their endocrine profile. Basically, poorly regulated blood sugar and thyroid hormones throw off the overall hormonal balance you absolutely need for successful implantation.
We also have to take a look at the immune system. Antiphospholipid syndrome, or APS, is an autoimmune disorder. With APS, an individual's immune system mistakenly forms antibodies that actually target substances involved in the blood clotting process. APS has been directly linked to recurrent pregnancy loss and fetal deaths. Identifying it is a massive step in getting you the right treatment.
Finally, there are lifestyle and environmental factors. Now, it is so important to approach these without any guilt whatsoever. Treat them simply as variables you and your doctor can work on together. Things like smoking, high caffeine and alcohol intake, exposure to certain toxic products, and being overweight can all add to the risk of RPL.
Section 4. Testing and Assessment.
Okay, so now that we know the potential causes, how do doctors actually figure out which one is affecting you? Rest assured, they have a highly structured roadmap for this. Step 1 is always a complete patient history and a physical evaluation. Then, in Step 2, they'll run specific blood tests, checking out those hormones and immune factors. And they'll examine the uterus for structural issues like the fibroids or scar tissue we mentioned. And Step 3 often involves a genetic compatibility test on both partners to check for potential genetic deformities, like those translocations we discussed earlier.
Section 5. Treatment and Next Steps.
Once the assessment is all done, how do we move forward? Well, before we talk about specific treatments, we really need to clear up a massive misconception. A lot of people ask, does folic acid help prevent miscarriage? Look, folic acid is absolutely essential. It supports healthy fetal development and prevents neural tube defects. But folic acid alone cannot directly prevent recurrent pregnancy loss if it's caused by the genetic, uterine, or hormonal factors we just explored. It is super necessary, for sure, but it's not a magical cure-all.
So the absolutely crucial point to remember is this. Treatment depends entirely on your specific underlying cause. There is literally no one-size-fits-all pill for this. If it's a structural issue, well, that might require a minor procedure. If it's hormonal, like thyroid dysfunction or PCOS, medication can help balance those levels out. If it's an autoimmune issue like APS, specific blood-thinning treatments might be used. The path forward is highly tailored to you.
I want to wrap up this explainer with a really direct, encouraging quote straight from the clinical experts at ART Fertility Clinics. Many women with RPL can still achieve successful pregnancies with proper evaluation, diagnosis of underlying causes, and appropriate medical treatment. You have the data, you understand the biology, and now you know the steps for assessment. The medical tools literally exist to help you navigate this. So armed with all this understanding, what will your next step be on your journey toward building your family?